IMS has impacted our relationship with our patients in a positive way, where we are able to track so much and just be one step ahead of our patients.
IMS has a positive impact on my relationship with my patients. I particularly like that I'm able to converse with my patients via the patient portal. The patient is able to contact me directly without having to go through the front office staff. I think that builds my rapport with the patient. I think it develops my relationship with them so they know that I am accessible to them.
Using the portal, there's a lot of patients that no longer want a phone call to discuss what's going on with them. So continual use through the portal to communicate between the staff, the nurses, the billing team, and the patients has really made it a quicker process and not as much back and forth with the patient, and allows them to respond in an easier fashion than picking up a phone call and waiting for business hours.
Definitely allowed us to have better patient outreach communication, giving patients portal access and texting and emailing capabilities, as well as telehealth, has really been a huge impact for our patient and patient care outreach.
IMS offers solution, I believe On Arrival is their patient kiosk. Makes it really easy to go ahead and get them checked in, and now you can serve them easier. So they're not filling out a lot of hand paperwork. They're doing it digitally before they come to the appointment or on a tablet. That has really helped kind of reduce some of our patient wait times, get them in the clinic sooner so we can see more patients.
It has helped us be more in communication with our patients. People send in a request to the portal, I get it as a reminder or a task, and so I'm getting that information pretty much real time. Getting messages through IMS has been better than on sticky notes or on pieces of paper, because we rarely get missed things. If they get sent through appropriately through the reminder section in IMS, I can answer it, send it right back to the staff that needs to handle it, and then they can take care of it with the patient.
We have the portal, and they have the ability to get their information in real time. Letting them get that information and working with them and getting their appointment requests through the portal. I think it's, as our patients learn to navigate through the technology too, they make sure that they're not getting dropped or they're missing something.
IMS provided a comprehensive, detailed documentation for the flow within the practice. So we use it to communicate among staff and document every encounter with our patients. That makes access to that information readily available at any time. So it really helps to have such a thorough, detailed flow in there, because it allows the staff to easily find the information they need, and for us to get back to our patients and provide the best care we can.
I think because we're able to provide our patients with very clear-cut financial packages, it makes it easier for the patients to not have to necessarily worry so much about the financial pieces, because they don't have to jump through a lot of hoops to understand what that looks like for them.
IMS also helps build my relationship with the patient. I particularly like that I'm able to provide customized care plans to my patient, so that they can leave with something in their hands to kind of reinforce my treatment plans.
MediTab and IMS, I think, has been the key to streamlining our processes, improving the quality, making sure we're closing the loop on processes and patient care. So the patients have benefited even if they didn't know it. Patients continue to evolve in their knowledge of technology as well. So I think the further we go along with IMS and the more technical we get, we evolve with the patient needs, not only on the healthcare side, but the technical side. And it was our number one choice in my tenure to be a health center that is 100% patient focused.